90-year-old Margaret Keenan from Enniskillen, who lives in Coventry, became the first person in the world to receive a clinically authorised vaccine for COVID-19. This marks the start of the NHS's Herculean task to deploy vaccine right across the UK, in line with its founding mission to support people according to clinical need, not ability to pay. And this simple act of vaccination is a tribute to scientific endeavour, to human ingenuity, and to the hard work of so many people. Today marks the start of the fight back against our common enemy, coronavirus. And while today is a day to celebrate, there is much work to be done. We must all play our part in suppressing the virus until the vaccine can make us safe, and we can all play our part supporting the NHS to deliver the vaccine across the country. This, Mr. Speaker, is a task with huge logistical challenges, like the need to store the vaccine at ultra-low temperatures, the clinical need for each person to receive 2 doses 21 days apart, and I know that the NHS will be equal to the task. I'm sure we will do everything that we can, everything that's humanly possible, to make sure the NHS have whatever help they need. The first 800,000 doses of the Pfizer BioNTech vaccine are already here in locations around the UK, and the next consignment is scheduled to arrive next week. This week we will vaccinate from hospitals across the UK. From next week we'll expand deployment to start vaccinations by GPs, and we'll vaccinate in care homes by Christmas. And as more vaccines come on stream in the new year, we'll open vaccination centres in larger venues like sports stadia and conference halls. Mr. Speaker, people do not need to apply. The NHS will get in touch at the appropriate time. And when that time's come, we have one clear request. Please step forward for your country. I want to thank all those involved, the international team of scientists, the globally respected regulator, the MHRA, Public Health England, the Vaccines Task Force, and all the volunteers who took part in the trial, and all those who have come forward for vaccinations so far, and all those who will do so in the future. Months of trials involving thousands of people have shown that this vaccine works and is safe, and by coming forward, you're taking the best possible step to protect yourself, your loved ones, and protect the NHS. Mr. Speaker, help is on its way, and the end is in sight, not just of this terrible pandemic, but of the onerous restrictions that have made this year so hard for so many. But even while we can now see the route out, there's still a long march ahead. Let's not blow it now. There are worrying signs of the virus growing in some parts of the country, including parts of Essex, London, and Kent. And over the coming weeks and months, we must all keep following the rules to keep people safe and make sure we can get through this safely together.